Behavior therapy or behavior modification is a type of psychotherapy that focuses on directly changing maladaptive behavior patterns by using basic learning principles and techniques. Behavior therapists assume that maladaptive behaviors are learned just as adaptive behaviors are. Techniques based on classical conditioning. Mary Cover Jones, the first behavior therapist, pioneered the use of behavioral techniques in therapy. She explored ways of reversing conditioned fears. In treating 3-year-old Peter's fear of rabbits, Jones used a procedure now known as counter-conditioning, a technique based on classical conditioning that involves modifying behavior by conditioning a new response that is incompatible with a previously learned response. Jones also used social imitation or observational learning techniques. Developed by South African psychiatrist Joseph Wolpe, systematic desensitization is a type of behavior therapy in which phobic responses are reduced by pairing relaxation with a series of mental images or real-life situations that the person finds progressively more fear-provoking based on the principle of counter-conditioning. There are 3 basic steps involved in systematic desensitization. First, the patient learns progressive relaxation, in which involves successfully relaxing one muscle group after another until a deep state of relaxation is achieved. Second, the therapist helps the patient construct an anxiety hierarchy, which is a list of specific anxiety-provoking images arranged in a hierarchy form, at least anxiety-provoking to most anxiety-provoking. The patient also develops an image of a relaxing control scene. Third, while deeply relaxed, the patient imagines the least threatening scene on the hierarchy. After he can maintain complete relaxation, he moves on to the next scene, and so on. In practice, systematic desensitization is often combined with other techniques, such as observational learning. Virtual reality or VR therapy combines systematic desensitization techniques with exposure to a computer-generated 3-dimensional environment, which the viewer experiences as if it were real. This therapy is easier and less expensive than standard therapy. VR therapy has become an accepted treatment for simple phobias and is now being extended to the treatment of other anxiety disorders, including post-traumatic stress disorder. The text talks about the bell and pad treatment. It is a technique used to treat nighttime bedwetting by conditioning arousal from sleep in response to bodily signals of a full bladder. It is effective in about 75% of school-age children who have difficulties with bedwetting. While the text emphasizes this, I personally have never known anyone to use the bell and pad treatment. Aversive conditioning is a relatively ineffective technique that involves repeatedly pairing an aversive stimulus with the occurrence of undesirable behaviors or thoughts. It is used in treating substance abuse, sexual deviance, self-injurious behavior, and compulsive gambling. Techniques based on operant conditioning. Behavior therapists have developed several treatments derived from B.F. Skinner's operant conditioning model of learning. Shaping involves reinforcing successive approximations of a desired behavior. Positive and negative reinforcement are used to increase the incidence of desired behaviors. Extinction, or the absence of reinforcement, is used to reduce the occurrence of undesired behaviors. The first step in a treatment program is to identify specific problem behaviors and determine their baseline rate. The therapist then targets each problem behavior and objectively measures the progress towards specific behavioral goals. In a token economy, the therapeutic environment is structured to reward desired behaviors with tokens or points that may eventually be exchanged for intangible rewards. This is used very much in public schools, where if you get 4 stars, you get to go to the pizza party. Contingency management interventions involve carefully specified behaviors, a target group of clients or patients, and the use of vouchers or other condition reinforcers that can be exchanged for prizes, cash, or other rewards. They have proven to be especially effective in the outpatient treatment of substance abuse and dependence. This concludes this part of Chapter 14.